So a little bit about bone drugs. Okay, so you got osteoporosis, osteopenia. They say, hey, take this drug; it'll strengthen your bones. We're going to talk about how, yes, it does strengthen your bones, but it's a total, complete misunderstanding. I don't know if the doctors even know this or not. I hope they don't, because if they do, it's pretty sad that they prescribe these things. But there's different types of nutrients in your bones. The osteoclasts are like the remodeling crew. Okay, when you have old bone tissue, sick tissue, diseased tissue that shouldn't be there, it scrapes it off to get ready for the new tissue to come in and be built to create new bone. Because remember, again, bone is a living organism. It's continually regenerated, constantly. Okay, so you got your remodeling crew, then you got your carpenters. These are the osteoblasts. Okay, the osteoblasts are like, all right, what are we going to do to build this bone? We got some magnesium, we got some calcium, we got some silica, we got some strontium, we got some vitamin D, vitamin K. They take all those nutrients and they build bone. So this is an ongoing process in your body, continuously, all day, every day. Okay? Fosamax and Actonel and all these other bone drugs, they stop the function of the osteoblasts and osteoclasts. Okay? So in other words, these guys can't discard damaged, dead, weak bone tissue, and they can't build new bone tissue. So what happens is your bones get hard and brittle. And then your risk of fracture goes through the roof. Absolute fact. I can show you tons of studies that taking bone drugs increases your risk of fracture. Because what happens is your bones harden and they're not pliable anymore because they're not renewing themselves. When you fall, your bone will literally shatter into 1,000,000 pieces. And you're done. Nothing else you can do about it. So these are some of the known side effects from some of the bone drugs. Major inflammation, ulceration, hepatitis, pancreatitis. You know, these are all inflammation conditions. Seizures, and bone fractures. Those are some of the well-known, well-studied, documented side effects from taking some of these bone drugs. And to top it off, it does nothing to help build bone.